Good morning, Jay Farrar in for Elias on this Christmas Eve. Public health officials in Quebec have confirmed 8 cases of measles as part of a current outbreak in the province, with infections detected in regions including Montreal, Laval, the Laurentians, and Lanaudière. Health authorities are urging residents to be aware of symptoms and ensure they're protected, with many hospitals already over capacity with this recent flu virus going around. Does this measles outbreak pose an increase in danger? To help us break it down is Dr. Jesse Papenburg. Joining us, pediatric infectious disease specialist and medical microbiologist at the Montreal Children's Hospital. Good morning, Dr. Papenburg. Thanks for taking the time this morning. I appreciate it.
Good morning.
So what does the confirmation of these cases in Quebec, 8 right now as far as we know, tell us about the status of the outbreak locally here?
Well, it's evolving, and it's obviously quite concerning because 8 cases, some of them had contact with each other, no contact, others not necessarily having an epidemiologic link. So we're very concerned that there might be some transmission that's going on in the community that may not have been detected.
Mm-hmm.
That being said, I'm also reassured that the numbers have not been increasing on a daily basis. It's been a slow creep there. So hopefully the hard work that public health officials are putting into contact tracing and making sure, doing all the interventions they need to do to limit the spread is hopefully paying off.
I know that there was quite a bit of investigation going on when it comes to locales that have been identified as exposure sites. Has that helped in kind of keeping track of how the virus is being spread?
Absolutely. It's very important that people who were potentially exposed are assessed with regards to their risk of potentially acquiring measles.
Mm-hmm.
And there are some restrictions in terms of if they are at risk that they should be staying at home until they can determine that they're not infected. So essentially, anybody who was born before 1970 in Quebec is considered immune. That's because there was enough measles being transmitted at that time that pretty much everybody got it. People born between 1970 and 1979 are considered immune if they got one dose of the measles vaccine or more, whereas if you're born in 1980 or afterwards, you have to have received at least 2 doses of the vaccine to be considered immune.
Okay. So let's say individuals who think they may be susceptible to exposure or experiencing symptoms, what are the recommended steps for those individuals?
Well, first of all, if the symptoms of measles are, high fever,
Mm-hmm.
Conjunctivitis, so red eyes, runny nose, cough, feeling unwell. But the classic symptom is the rash that starts on the face and then spreads down to the rest of the body. Unfortunately, people are infectious for up to 4 days prior to the start of that classic rash. So the measles might not be really suspected until the rash comes out. And if you do suspect that if you've been exposed and you start having any of those symptoms, really it's important that you be tested. But before going in to be tested, you need to let wherever you're going, whatever clinic that is, know that you suspect that you might have measles, because they might direct you somewhere else. But if they are available to do testing, then they need to put specific precautions in place, because measles being so transmissible as an airborne virus, there are specific infection control measures at the clinic that need to be put in place for any suspected case.
Are there any challenges right now that Quebec health authorities are facing when it comes to maintaining a high vaccination coverage for measles?
Well, you're right. That is the challenge right now.
Right.
Unfortunately, we are in many parts of the population underneath the 95% vaccination coverage that's required, so that when there is an imported case, that there isn't ongoing transmission in the community. So you can think about certain high schools where the vaccination rates are, certain schools, and even high schools or elementary schools where vaccination rates are well below that. Certain communities also, either for religious or cultural reasons, that don't have have very low vaccination rates, as well as people coming from other parts of the world that perhaps their public health programs aren't set up in a way as solid as ours, and their vaccination programs might not have allowed them to get protected against measles. So There are multiple places or groups of persons where public health has been putting in a lot of effort to try to increase vaccination rates. And what I really like to see is an ongoing investment from the government and the Ministry of Health into improving vaccination rates. I think the place that we could start is in our school-age children, because they are overrepresented in the measles outbreaks across Canada. And making sure that getting into the schools and really putting in the manpower that's needed to get to these populations so that we can increase the rates and protect the individuals that themselves are susceptible, because measles is not some benign disease. It can be very serious. We need to protect them and protect the community.
Not to mention, I guess, the roadblocks that you face when it comes to cultural trends in the wake of the pandemic and the anti-vax movement that went strong during that time. And I guess, I don't know when the last time I heard of a measles outbreak in Quebec was. Do you know what the time span has been?
Well, measles was considered eradicated from Canada since the late 1990s. And when we did have the our most recent outbreak, which was in 2010 or 2011, I don't remember, we're talking it was just a few hundred cases, and that was considered a big deal. So if you think about the thousands of cases that occurred in Ontario and in Alberta, and several hundred cases that we had in 2024, I never thought that as I was training infectious diseases, learning about measles, it was such a rare occurrence that you had to look it up in the textbooks to know how to recognize it. At least for me, being trained more recently, I never expected that we would lose our measles elimination status in Canada. So there's just no two ways about it. We need to increase vaccination rates, and there needs to be put in a lot of effort, and it has to be investment to be able to do that. It has to be a concerted effort. It needs to be a goal of our governments.
Just to touch on that nasty flu bug that's going on right now, it seems to be overwhelming. Once again, the healthcare system, emergency rooms are running at 100% or even at 200% capacity in some cases, as well as the 811 line has a 2-hour wait at some points. Do you have any advice for those who might be suffering from what may be conventional or generic flu symptoms, and how to maybe stay out of the healthcare system if it's not necessary?
Right. So you're right that it's been a remarkable influenza season, and because it started a little bit earlier than usual, but the rate of increase in cases has been really remarkable.
Right.
A very steep epidemic curve. We're talking about over 30% positivity rate in Quebec right now. In kids that are of school age, so 5 to 17, that's 70% positivity. It demonstrates a remarkable amount of transmission. So what I can say is this: if somebody has a sudden onset of fever that's accompanied by either cough or sore throat or muscle pains or fatigue, that, until proven otherwise, is influenza right now, because there's so much circulating. And when it comes to families, I would say in young babies under 3, whether 3 months of age or less, any fever is important to go to the emergency department and be seen by a doctor. Okay. In older kids, the danger signs are rapid breathing, difficulty breathing, signs of dehydration. In other words, kind of like a flower that hasn't been watered. They just kind of overall wilt. They get dry mouth. They won't urinate. So these are danger signs for kids, and lethargy, where they're just even in between fever spikes, they just have no energy. So these are the reasons that families should go get checked out by a physician. And if not, influenza, you can have fever for several days. And if you're otherwise well with the fever and you don't have any other worsening of an underlying medical condition, because we know that people with heart disease, lung disease, they're at greater risk of complications, then maybe you don't need to see a physician just for the fever. But if you have any of those warning signs, or if you have a medical condition that's getting worse that's associated with this infection, then that warrants a visit to a physician.
Great advice. Thank you so much for taking the time this morning, Dr. Papenburg. I really appreciate it.
It's been my pleasure.
Enjoy your holidays, and again, thank you. Dr. Jesse Papenburg, pediatric infectious disease specialist and medical microbiologist at the Montreal Children's Hospital.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian-owned and operated. Charm has been part of your love stories and bromances for over 50 years. And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.